So in this section, we're going to talk about what to do after your vasectomy and what to expect after the vasectomy. And as I've said in an earlier section, the vasectomy is quite straightforward, it's quite simple, it's quite quick, and you'll be able to leave straight away after the procedure, and you won't be any discomfort at that stage. Now, one of the things we'll give you to take away with you is a small single-use ice pack. We'll ask you essentially as soon as you get to your car and sit down to activate that ice pack, put it directly over the scrotum, now on top of the clothes, doesn't have to go inside your underwear, just to keep that area cool on the way home. And I would like you to continue to ice that area for the next couple of hours. No point doing it all day, but 2 hours or so of icing after your vasectomy is ideal. Now, you don't need to give yourself frostbite down there. If it gets a bit cold and uncomfortable, just have a rest, let things warm up, and then put the ice back on again. In addition, as I said, you're going to leave feeling completely comfortable, but after a half an hour, 45 minutes or so, the local anaesthetic is going to wear off and you're going to be left with a sort of an aching sensation in that area. A bit like you were kicked in the balls quite a while ago. Not the sudden pain of being kicked right there and then, but the ache that occurs after that's happened. For that reason, we'd like you to take it easy, and also we are going to give you some pain relief to take for that day and for the rest of the week should you need it. The pain relief we normally give you is ibuprofen. It's an anti-inflammatory painkiller. If you're able to take that, that's ideal because not only does it help with any discomfort, but it keeps inflammation down. So in that case, we ask you to take it continuously for the rest of the week. And then even if you're comfortable, the inflammation of the vasectomy will be kept at bay and you'll continue comfortable during the recovery phase. If you're not able to take that, we advise you to take paracetamol and we can give you some of that instead. As we said in the procedure video, there is a small hole left in the skin, 3 or 4 millimeters in size, and we allow that to heal up naturally. Now, this hole is not going to allow anything to get inside the scrotum and it's not going to allow anything to fall out for sure. So it's absolutely fine to still have a shower or a quick bath. But I would advise that you try and avoid using spa pools, going swimming in the sea or public pools because we can't be so sure about the quality of the water and the prolonged soaking of that area does increase your risk of infection. Now, infection, as I've said before, is pretty rare in vasectomy, but if you do get an infection, the signs to look out for will be an increasing discomfort around the scrotal area, usually 3 or 4 days after your vasectomy. So you tend to be getting better and then think, oh, it's kind of getting more achy again. And you may even find the area gets a bit swollen or hot or red, or you might actually feel a bit like you've got an infection. You might feel some fevers or chills or anything like that. Any signs like that, we'd encourage you to contact us as soon as you can and we can get you onto some antibiotics if we're worried. We will be giving you at the time of the procedure some phone numbers, both to call us during office hours or a number to call 24 hours a day if there's any urgent problems that occur after hours, so you can always get hold of us. Now, I've alluded to it before and I'm going to say very clearly here, the biggest mistake that men make after a vasectomy is after a few days they feel fine and they just think, I'm okay, and they get back into physical activity. And we've already said to you, please just take it easy for 7 days, whatever happens. And this is because although you might be feeling better, the area down there is still quite fragile, it's still healing up. And too much exercise, lifting, moving around, bending and stretching can cause little blood vessels in that area just to start weeping, and they can cause bruising, swelling, and quite a lot of discomfort. And you can end up having discomfort for a number of weeks. So please take it easy for 7 days, no matter how good you feel, okay? And for that, I mean, no going to the gym, okay? No need to go doing the firewood, jumping on a farm bike if you're a farmer or whatever it might be. Just try to stay away from exercise or things that get you into awkward positions, okay? If you've got a physical job, make sure you don't have to do that or the physical part of that job for the next 7 days. If needs be, we can give you a note for work for that purpose. And with regard to exercise, also like to talk about sexual activity. Now, having an erection, ejaculating after a vasectomy, immediately, as soon as you want to, not a problem. But obviously we don't really want you to be bashing that area around too much for the first 7 days, or indeed doing too much physical activity, as I've just said. So no swinging from the lampshades, no acrobatic sex, but gentle sexual activity is fine as soon as you want. But bear in mind that for some guys after a vasectomy a bit of blood can get into the ejaculate. So when you ejaculate, you can see either streaks of blood or even it looks blood colored. It shouldn't be painful, but you might see that, and obviously if you haven't been aware of that, that could be quite shocking. So it can happen, it's fine if it does, and it will settle down after a few weeks.